Hi all, Kevin Gallagher here, RESECT Study Lead. I just wanted to make a very quick video to show you how to view reports on the RESECT patient project. Here you see I'm inside the RESECT patient project. I'm in an imaginary data access group 59344 or site ID number. You will at some point be able to see this option menu on your left hand panel, which is called reports. You won't have the ability to create reports, but you will have the ability to view reports of the patient data, and we will create the reports that are going to be useful for you to use. So you can look inside this report here called case report new recurrent, and you'll see all of the cases that are listed at your site, and you'll see the field which tells you whether they're a first or recurrent tumour. And if you want to see how many of each there are so that you can tell if you're meeting the study requirement, remember it is a stipulation of the study that at least 80% of the cases submitted must be first TURBTs in patients who never had non-muscle invasive bladder cancer before, and a maximum of 20% can be for recurrent tumours. And once you've clicked on the stats and charts button at the top, you'll be able to see that it gives you the count here in this imaginary group. 70% are first TURBTs and 28% are recurrent tumour TURBTs. So as I'm recruiting my patients, bear that in mind, that I need to do the list of consecutive first tumour TURBTs first, so that if I was aiming for the minimum requirement, I get 20 first tumour TURBTs and then have space for the 5 recurrents if that's what I want to do. But remember, if you want to submit all of your cases as first tumour TURBTs, that's okay, if you have enough cases to cover that. Any questions, just drop us an email. Thank you. Bye.